Hey everyone. So this is day 13 today. Day 13 of the radical treatment that I'm on in order to mm, uh, get my immune system pretty much to a level where I can actually um, function and survive properly and be treated for other problems that I have. So, how did I get here? How did this happen? Um, um, let me let me go back and try to answer any doubts or questions on how can something like this happen. How I'll do the best I can without I'm not it's not I'm not blaming anybody. I'm not pointing the finger at there is no point. That's not my goal. I'm just trying to explain how I got here, how I got into being in this radical uh, treatment that is practically it's pretty dangerous, I guess, the side effects, and also because I'm in this state, I can get any type of bacteria or disease that will basically uh, cra- crash to the point where it'll kill my body. So if I go back to October 2016, um, I had a liver exam, a liver test to see how bad my liver was, the cirrhosis of the liver. They have a machine where I had my family doctor, and it's pretty quick. It gives you a number, and then a specialist talks to you. So in October 2016, my liver was on the path where it'd be full cirrhosis and I'd need a transplant or whatever the options were going to be. I'm pretty aware that there is no way I could get a transplant. Um, Everybody that I know that has had severe liver problems, and um, I have friends that were on a liver transplant. They never got a liver. Of course, there's always somebody that needs it more than somebody that is has HIV or has complications or XYZ, and that's fair, and I understand that. So I was told, because I was asking questions at that time, like, why is my liver in such poor shape? I don't drink alcohol, I don't abuse this and that. And I was, I guess, to be honest, I was playing dumb because I know very well that a lot of medication will hurt your liver, or will cause your liver to get into the cirrhosis of the liver. However, I was told that I was fat, overweight. I didn't eat right. I didn't exercise, and that's the reason why my liver was in this shape. I didn't say a word. In my head, I'm like, this doesn't sound right. I felt insulted. I felt, I wouldn't say lied to, but it was pretty much BS in my mind. So I left there, and from that moment, I started doing research online. I researched the over. I had a dozen of medication I had to take every day. So I looked at each one of them online, and what like most of them caused kidney problems, liver problems. It was just everything was interacting together, and I'm like, my entire body is probably like going nuts every time I take these medications every day, and I'm pretty sure 75% of just that is affecting the liver, and the rest is, yes, okay, I was overweight, I wasn't exercising, I wasn't eating properly. So um, then personal issues happened at, the end of 2016, and I went to see my family doctor in January for I needed him to sign something for it was it's very simple. It was a trip that I had booked, that I had planned, and he had said I couldn't go medically, couldn't fly, or something like that. So I had already brought the cancellation papers, and in that appointment, he was late. I had to see the nurse because they had to weigh me, take my pressure, all that stuff. And they all, they asked, well, why you're here, and I just said, I just want some forms to be signed, and anything else, I'll come back at another time. I need to get these forms signed today. He looked at me and he said, you don't look well. I said, I feel fine. And he's like, no, I think you should go to the ER. I'm gonna send you to the ER and have some tests done there. I'm like, you haven't even looked like, I didn't understand, like, how can somebody look so bad that they need to go to the ER and have some tests done. Fine, yes, my pressure was high, but still, in any case, I asked him, I said, I just need these forms signed. It's for a cancellation of the trip, and so that I get 100% reimbursement. He wasn't he wasn't happy that I had, first of all, booked a trip, and second of all, he said that he needed to be at the hospital for X time, for whatever time, and he had no time left. Of course, at that time, I had, pretty much an attitude problem, in the sense that it's the way he was speaking to me, and like really purposely not signing something that I'm already telling him that it's important, I need it. If not, I'm not going to get the 100% reimbursement. And he would just not budge, and he's like, you always, and then he started like just going off on me, like, if you don't get your way, you get upset, you never listen, you're such a difficult patient, you're just full of problems, and that's because you never listen, and you reject everybody's help. Whatever he said, I just snapped. I tore the papers, I threw it in his face, and I said, and that's when I just called him every name in the book. From anyways, I apologize for my language in advance, but I called him a homophobic asshole, that he's the doctor, I'm the patient, he should know better. Not to excuse whatever attitude I've ever had with him, or if I didn't listen to him, or whatever. I'm still the patient. I'm still like, he's the medical professional. He's the doctor. He's supposed to, be there, or do help me medically. If not, then send me to another doctor. And so. And then after I called him a bunch of names, I slammed his office door and I walked out of that medical office. Right then, I had it, and I decided to. I've had this doctor for 9 years, and from what I've heard, from what I've tried to talk to other people, is that um, I needed to switch doctors, and it was should have been done a long time ago. He wasn't helping me anymore. He didn't want to help me anymore. He was finding any excuse to uh, put the blame on me if you know, like, if something was wrong, or if I had a new problem. And every time I had a new problem, he would give me a new medication. So I spoke to the pharmacy where I get my medication, and they had to do a chart to explain when to take each medication, what it did, and with the side effects, because they felt bad on how much medication I had to take every day. And they said it's not possible that somebody can take all these and not have any interactions, any side effect, anything that will, you know, it was clouding my mental state, my judgment, and physically it was like not good. So I decided, and it was killing my liver. And it's hard to have anybody, I'd say, believe what I'm saying or saying about a doctor or somebody in the medical profession. So everybody thought I was lying or exaggerating or creating drama. And you know what? I deserve that. With my mental illnesses, I was not stable because of all the medication that I was under for my disorders as well. So I decided, you know what? That's it. I needed to do something radical to get something. My goal was to, like, make my liver good, to show that I stopped all my medication, and that would, at least somebody would notice that, and would start asking questions, or would look into my file and understand that by stopping all my medication, my liver would be good. It was a risk. It was listen, I of course, but you know what? I felt I had no other choice in order to get somebody to listen to me and to take me seriously, and to, like, have somebody, a medical professional, take me under their to get a new medical professional to look into my medical file, make the appropriate tests, look at everything, and then we'll see, you know, what's the real problem. And again, I wasn't doing this to blame anybody, or I was doing this for myself, to save myself from catastrophe, because I know I was heading down that road and I couldn't stop it. And all I was doing is taking all these medications, and it was really killing me inside. So from January 2017 to October 2017, so that's 10 months, I did not take any medication. Now, that included a medication that I needed for bleeding ulcers and for acid reflux, all that. I suffered crazy. The acid reflux, I was vomiting acid. I had trouble sleeping. I felt it wasn't because I wanted to suffer, of course. It was, if I'm going to prove a point, I can't just pick and choose the medication that I want to not take and the ones I want to take. So I cut everything. In October 2017, I had my follow-up liver exam after the one in October 2016. The exam, they did it 2 or 3 times because they thought the machine was not working. I saw the number. The number was 4.1 or whatever, which means my liver was in perfect shape. It's actually a healthy liver, and that means it regenerated itself in 10 months. Because technically, I stopped the medication in January, but we could say a year if they want to be that technical. From October 2016 to October 2017, my liver regenerated itself to 4 point, I think it's 4.3, but they didn't want me to keep the results. So I met with the same liver specialist, and he said, what did you do? Like, I got total attitude. The year before, where he was all smiley and all like nice and calling me fat and I needed to exercise. So yes, I had attitude because I was still upset from the way he was treating me last time, and the way he was saying how my weight and everything else had to do with my liver. So I said, well, I stopped all my medications. I've started to eat better. I've exercised and I've lost weight. And I saw the number and I saw the paper in his hand. And he said, well, congratulations. Now you've put your body into jeopardy, or some weird rude comment. And at the same time that was there, I had a skin rash that was pretty much sporadic over my body, and it wasn't psoriasis, but it was itchy, and it didn't look right. So I had also made an appointment to see my doctor at the same time. Even after what happened in January, I needed him to look at the rash and give me a cream. I mean, I didn't know what else it was. It wasn't eczema. So the liver specialist threw me out of his office because he wasn't happy with the way I had done the. So, but that wasn't my point. It wasn't for him, or I needed the proof. I needed it to be somewhere that my liver had regenerated because of all the medications that I didn't take, which my point was I was over medicated. Nobody wanted to listen. Nobody wanted to believe me. So I get shipped into another office, and it's not a nurse and not a doctor. It was an assistant or something, and she's like, "You're waiting for your doctor for the rash." I said, "Yes, I've already seen the liver specialist. I already know about my liver. It's all in good shape." And she's like, "So you've stopped your medication? You're not on any medication?" I said, "No. I'll let my doctor know once I see him." And she said, "Well," and she's looking at the screen, and she's like blank, like she's not talking. She has a blank face. So I'm like, what is going on? Like, what is the problem here? She's like, "Well, he canceled the appointment." And I said, "You're going to tell me that I don't have an appointment anymore?" She said, "Well, yes." And you could tell she knew that it was odd. And I said, "So he canceled it? He canceled himself? Like, he canceled my appointment himself?" And she said, "Yes, it was canceled by him." And she's like, "Well, let me just go see somebody a minute, and I'll come back." So I'm left in this room, and I'm like, what is going on? Like, somebody has to look at this rash. So I get shipped into another room by another liver specialist, not the same one I saw in the beginning that wasn't really happy with the way I had regenerated my liver, let's say. And she looks at me and she's like, "Wow, that's not a good rash, or that doesn't look good." And she's like, "Is it painful?" I said, "Yeah, it hurts, and it's itchy, and I don't know what it is, and it's making me panic." And I said, "The eczema cream that I have, I don't have it. It's done. There's no more renewal." I said, I need a prescription." And she's like, "Okay, I'll be right back." So again, I'm wondering, what is going on? What is so bad? Like, what have I done that is so horrible that I can't even get anybody to just look at my body, assess like the rash, or give me a cream, give me an antibiotic? I don't know. I'm not an expert. I'm a patient, and I feel like I'm being like bounced around, and I knew this was not right. So finally she comes back and she said, "Listen, and she's just like, I just like at that point there, I wanted to just scream, and I was like, it's not their fault. Like I was just trying to calm down, and so I told her, I said, what's the problem? Just be honest with me. Like look at me. Like it's already been a couple of weeks that I've had this rash there. She's like, I don't know what it is. I'm a liver specialist. I'm like, yes, I understand. She's like, I've been asked to write you a prescription. And I'm like, wow. Like, I think 3 or 4 people had seen me that day, and my own doctor cancels the appointment and knew that I had some kind of unknown skin rash or whatever, which I bet anything, like he, I shouldn't speak for him, but I bet, like everybody assumed that it was psoriasis, and that, so I'm like, I know what psoriasis is, I know what eczema is, this is not it. Anyway, so she gives me a prescription, and she said, Luemba said, I shouldn't have said the name. Sorry. My doctor, she said your doctor said to come back in a week, or no, 2 weeks, something like, so that he can absorb all this. And I'm like, oh my God. Anyways, I walked out of there. That was in October 2017. So the prescription that was written was for eczema. The size of the cream is about it's about the amount of cream that you would use on your eyelids. My rash was all over my body, and some Benadryl. That was a prescription. Oh, and Xanax for the heartburn, because I had when they asked me like you stopped all medication, what about your acid reflux and your ulcers? I'm like, it's very painful, but I couldn't just stop. I couldn't pick which one to stop. So of course, I didn't understand. Like, of course you don't do that. Nobody just stops their medication. Nobody tries to prove anything. I get that. I was trying to get somebody to listen, somebody to like just take the time to ask me questions about what's going on, and to just do the proper test and to look at my body. My doctors never touched me below the waist, ever. Never performed anything. So just put gloves. I don't know. Close your... it's like, how hard could this be? There's already been things that were missed because of it wasn't checked properly. I was just at the end of my wits. So I leave the clinic and I go in. I had a ride, and the person is like, you look extremely upset. And I tell him what happened, and he's like, that's insane. That's so wrong. He's like, it's not even believe, like, it's such a horror, like a horror, story or whatever. And he's like, of course, I know, I believe you, I know you enough for that. And I said, you know what, I don't care anymore. It's not about being believed. I'm like, this is so wrong, and I have, what am I supposed to do? And I went back home and I toughed it out a little bit. It was getting worse. I went to a clinic that was close to my house, and the doctor there wrote something on a piece of paper and put it in an envelope, and she said, you need to go to the emergency room right away. She's like, I don't even know how you're still talking and you're not, screaming of pain. She's like, this must be very painful. I said, yes, it feels like I'm burnt. And that's exactly what she had mentioned too, that I looked like my body had 2nd-degree burns. That's what it looked like. I did go to the emergency room. Because of what it looked on the outside, I wasn't a urgent emergency, patient to look over. And I sat and I waited, and I was in pain. It was hurting, and I could see everybody looking, because now at that point it was in my face. around my eyes, around my mouth, my ears, and it was like burnt, crispy skin. Like, and I could, it was full. The emergency room was full, and the chairs around me were empty because nobody wanted to sit next to me. And I probably looked like something contagious. Fair enough. After 4 hours that I stuck it out there, I'm at a point where I'm going to pass out. I can't take it anymore. I just want to be at home and suffer in silence. I don't like this was torture. People looking at me, feeling disgusted, feeling like I was contagious. I went back to see the nurse at the triage, and it was a man. I'm not being sexist, but I just want to mention. And when I come up to the window, I had tears in my eyes, and he's like, "Come here," and he's like, "Tell me what's wrong," and I just broke down, and he's like, "I am so sorry, we're very busy," and he's like, "I know, I could tell you are in such pain," and he's like, "It looks painful," and I said, "It's not your fault." I said, "I just appreciate you trying to make me stay," but I said, "I'll be honest with you, I'm going home. I can't do this." And he told me to be honest that I had at least another couple of hours to 3 or 4, like 2 to 4 hours more wait. And I said, "I can't do this." I said, "Is there going to be a record that at least I tried to come?" And he's like, "Yeah, it'll be here." And then he's like, "You should come back though, because this does not look good, and you can't just go on like this." So during December, Christmas time, and all that time, I said to whoever that I just wanted to be by myself this year, and I was just not feeling well, and I didn't want anybody to look at me in this state. So then 2018, and this is still going on. I'm still on no medication. I still haven't seen my doctor, and I didn't know the extent of what was going on, because there was also other things that were happening, and I was also working, and I was trying to I couldn't say I couldn't say it's just you don't say that. And since I had gone a couple of times and I missed work, and my work was like, "So what happened?" I'm like, "I've got the shingle." Like it's not that I wanted to lie, or what else? I was too embarrassed to say my own doctor doesn't want to see me, and so I said, "I have shingles. They gave me antibiotics. I'll be okay." But it's because from that October to January, February, I also was like, I wasn't sleeping. I couldn't sleep, and my skin was just burning and cracking off, and there was dead skin. There was skin everywhere in my apartment. It was just falling off of me. I was getting weaker and weaker, and very frustrated. I was trying to ask the little bit of people that I have in my life if they could drive me to the hospital and take care of my dog. My dog was very important to me. I didn't have anybody to take care of her, and I was not going to leave her, because I knew that I was not just going to go to the emergency and come out the same day. That was not. I knew that I could, So, and I wasn't doing well at work. I mean, aside not performing, I was moody. I was I had a chip on my shoulder, they call it, but I was just, I didn't know what to do. I had nobody to turn to. I had nothing. So, again, I'm like, I'll just tough it. And then March came, and I started noticing that I was retaining water in my legs. in my abdomen. So I made an appointment with the nurse practitioner at the doctor's office, where the same place where my doctor did, because I wanted her to look at me. And the rash at that point was everywhere. It was everywhere, even my buttocks, my genitals. The only place it wasn't, it was my palms, the palms of my feet, and some places on my face, but it was on my head, in my ears, neck, even under my armpits. And it was burnt. It was falling. Pieces of skin were falling. I was putting Crisco every day in order to help with the pain and stuff. So I made the appointment for the 9th of March, the Friday. That was on Thursday. I told my work I have an appointment on Friday. I really need to see the nurse practitioner. I'm not feeling well, and I even switched my shift so I could work and leave early to go to the nurse. So everything was set. So that Thursday, the 8th of March, as work was progressing, even like around noon, around lunchtime, my legs, from my thighs, my calves, and my feet had swollen to the point the skin was breaking. I'm pretty much smart enough to realize that either my kidneys had stopped functioning, or my heart is not. Something was really wrong, and that trumped the rash, I guess. And also, I still didn't have anybody to take care of my dog, and that was so much stress. So I called the ambulance, and I spoke to the person first, and I explained my situation. And she's like, make sure your door is unlocked. She's like, I need to send you somebody right away. You're in danger. Like, it's bad. So I had three paramedics that came, and the look on their face, and I was forgetting about the rash at that time because I was concerned about my legs, and I couldn't really walk, and my dog. So there was 2 men and a woman, and I swear they were the nicest, most understanding. They just made me feel so good, okay. And I asked them, of course, not to use the stretcher. I didn't want to leave my apartment complex with me in a stretcher, and I asked them not to put the sirens. Now, as they're, prepping me, and I was trying to make it back, because they obviously said, I don't think you'll be back. Do you have anybody for your dog? And I said, no. And I started to break down, and one of them offered, for, if anything, like to babysit the dog for that. And I said, no, I mean, this, you could, jeopardize your job or whatever. I said, I'm sure I'll figure something out. I said, I'm gonna, can you help me leave more food, more water? And I have to set up, like her bed with her special knitted blanket, because that's her favorite blanket. And I put that on the ground, and she went in, and they even said, she knows that you're leaving, and it broke my heart. So the 2 men carried me, and I said, I made a joke. I had to make a joke. I said, this is, I guess, the best way of, going out is like this. So they put me in the ambulance, and then I got to the hospital on the 8th of March. And when I got to the hospital, there was so many people around me, and they were floored about the condition of my skin. At that point, I had no idea that it was there was blood in my face from the dryness, or the burn. I had blood coming down from my forehead, from around my nose, and around my mouth. my chin, and it was just like I had been into a fight. But they also noticed on my body it was also the same thing. And so right away they took blood right away. They started questioning me, and they looked at my legs, and they asked me about emergency contact. Like, is there anybody? Is there like you need to contact? We need somebody here, and I didn't understand what they meant by that. They said we need somebody that can make decisions if you're too much in pain. And I said, could you please speak in English? I'm like, just don't do this. I said, and I was trying to explain, like, and all of a sudden I just started like feeling floatish and like very warm, and my vision was like getting like a little tunnel. It was the oddest thing, and apparently I passed out. I woke to, and they were talking. They're like, "You just passed out from the pain and what's happening," and they're like, "We can't give you anything right now because we don't know what's going on. We need to do a lot of tests on you, but we can give you painkiller." They gave me Dilaudid by injection, and I had an allergic reaction to it. And by that time, there was a local Ottawa area a real family member that had arrived at the hospital, and I hadn't seen her in three years. And even at that, it was brief. And mind you, I had seen her at my mom's funeral, so sorry about that. So she went into kind of like shocked because she just couldn't speak when she saw me. And she just said, I can't believe this. She's like, how can this happen to somebody? So they spoke to her, and I don't know what happened at that point, because after I got the Dilaudid, then I went unconscious, and for a bit. And at that point, they had reached some family in Montreal that they said they needed to come down right away. They actually said to the family that they spoke to on the phone that I was not going to make the night. I did not. I don't think it was that severe, to be honest. I mean, so anyways, that's how we got to March 2018, and I was in the hospital for 10 days. I had a severe aggressive blood infection in my blood that was everywhere. It was shutting down everything. I had a severe skin infection that is because my immune system was basically none. I had no immune system, and a simple scratch that I was just scratching dry skin from the winter had turned into this type of rash. There's a name for it. I just don't know. And they were wrapping me with cloths that were damp, and then dry cloths, just like a burnt victim. I was now on morphine every 4 hours, and they were injecting me with morphine, and they still could not give me anything to fight the bacteria in the blood, because they did not know what type it was. So they kept poking me to get blood, and they would analyze that like a blood culture, and it takes days and days. So it became a point where my veins were collapsing because they needed so much blood. They needed to do so many poking and this, and then I had a dermatologist meet with me. I had a psychologist. Um, when I started getting better, because I was on, they were pumping me with the best antibiotics, whatever. Um, I met with three doctors that were psychiatrists or psychologists, and they asked me if they could do an assessment, and um, I of course was not going to refuse. I didn't mind. I welcomed it. They actually just wanted to make sure that I was sane, because of how I got there. Like, because they were aware that it started in back in October. I didn't end up in the hospital until March. Like, they needed to understand if I actually wanted to harm myself, and created this so that I would die. And I just said, I am not suicidal. I am not depressed. Those are the two mental things I can guarantee you, and I can tell you it was not because of that. And what was hard is that every time I would speak to like hospital staff, and I was very polite. I was very forthcoming. I was very honest. Um, they couldn't understand that I had nobody to either take care of my dog or to bring me to the hospital. And I'm like, it, just because it's hard to understand, like, it made me feel really bad about myself. And I think there's the doctor that could see that, and he's like, it's because you don't see that today, like in this day and age. And I said, I understand that it's very rare that you see somebody in my position where, if I tell you, I, this is the way I live my life, asking me 5 times or 5 different times to make sure that I'm not hiding something. I said, it really makes me feel bad about myself. And I said, it's not helping, but I just sucked it up, and I answered all the questions. So during my stay there, I think once I started feeling good, of course, I joked about my situation now, where I joke, we were making jokes, and hospital staff like were coming in and out. The nurses that had seen me one day were coming back to check like how good of a progress, and everybody would call me their little trooper. Because there was a point where they needed to like put IVs. They needed to, and they had to take it from the veins in my wrists, and that is extremely painful. However, I would ask them, like, don't even tell me when you poke, just go. And I said, so I was holding on to something, and I put something in my mouth to bite. And many times it had to be that way. I had an IV in my right arm that during the middle of the night I woke up because my entire arm was paralyzed, and I rang the bell, and the nurse was busy, and so I just waited. And when the nurse was able to come, she opened the light, and my arm, she could tell. She's like, oh my goodness. I said, could you please remove the IV? It's really hurting. And then she's like, well, I need to secure another IV first. I said, I think you should remove it right now, because something is not right. I said, I can't feel my fingers. I can't feel all the way to my shoulder. I said, if you wait longer, I don't know what's going to happen. She removed the IV, and the amount of pus that came out was disgusting. I had a severe infection from the IV somehow. So, and the vein was totally, like, it was just collapsed. It wasn't even good for anything. My arm was so sore. So they wrapped that up, and they put another IV in my other arm. Now, I think it was the very next day, something was odd with the IV on that arm now, And fair enough, it was a blood clot. So then they started giving me in little picks injection in the stomach for like thinning the blood, so wouldn't get more blood clots because I was getting clots. Anyways, all this to say, this happened in March, and when I was able to leave the hospital and I had passed all, like, I spoke to the shrink, and they diagnosed me with the same disorders that I had, that was diagnosed, like, 15, 20 years ago. The the borderline personality disorder with bipolar 2, OCD, severe postpartum PTSD. Anyways, I just used the two main ones, and I told the psychiatrist there that I don't want to harm myself. I don't feel depressed. I don't feel suicidal. And I said, that's since I've been off my mental pills, or whatever you call those. And I said, to me, I may be hard to handle because I have ups and downs, and I have high periods and low, I guess, mania, and the other one. I don't have depression actually, but shopaholic. I said, but to me, and that's just me, and everybody's different, and I said, especially me, I'm even more different. I would rather not take any medication for any mental disorder, but at least I am never depressed, and I'm not suicidal, and I don't feel like I'm nuts, and I feel good about myself. Yes, people will comment that, my goodness, you're so hyper, and you're like on a high, and like, are you on medication? And I'm like, it's hard to like even answer that. It's like, it's a personal choice, and they can't really recommend, or they can't. But I actually had a one-on-one with one of the psychiatrists, and the woman, and she said, you know what? I would never recommend this, but she's like, you're right. In your case, and it's in your case only, I would recommend no medication for you. She's like, I've asked you so many questions. You've been so patient and honest, and you've been smiling. And she's like, I am very confident and happy to say you are not depressed, and you are not suicidal, and you're not going to harm yourself. You're actually all the opposite. And she said, you just have to be careful because your OCD will get more extreme, and same thing with your social anxiety and panic attacks. And it's funny, when that was fixed, and I'm not back on, I never went back on those medications, so even after leaving the hospital. But they're not taking the medication for the amount of time, and even if I got sick to the hospital, I don't have any more blood pressure, I don't have any more cholesterol. All of these little things started to disappear. However, I understand that I got an infection, and I didn't want to blame anything, and they were not looking for that. They asked me so many questions. They saw that I tried to get help, and for X reason, I didn't get help. But again, it was just, I was just answering the question, and I was very honest, and I was trying to say, sometimes maybe I don't remember properly, or I don't have the maybe exact facts, but they said, you don't need to worry about that. We're doing tests on your body. We know what's going on with your body, and we've ordered your medical file from where your doctor was. They could see very fast that there was a lot of discrepancies with what was going on with my body and the medication that I was on, and what was, let's say, done, or what was in my medical file. So without saying, or what, they could see that something wasn't off. So anyways, when I left the hospital, I had a antibiotics that was in a pump that was through my artery to my heart, and I was on antibiotics for 2 weeks. And then I was starting to feel much better. I had the antibiotics. I had a nurse coming every day for 2 weeks, and then the specialist that was taking care of the blood infection, so that's where I needed the antibiotics, said at the end of, it was the beginning of April, you're done the antibiotics. The infection is not there anymore, because I had gone to get more tests done. Now, during the process that I was at home with this pump and this bag, oh my goodness, of course, and the people who know me, I forgot I had like a bag with an antibiotic and a string that was going inside my body. I kept forgetting. I kept getting caught. My dog got caught. Anyways, it was a nightmare. The pick got pulled out. Then the IVs that they had to replace in the meantime, every day would come out. So it was a tough time for the nurses and for me. So now, I know I've spoken a lot, and I don't know how beneficial this is for anyone. I just needed to tell my story and how I got here and why I'm on this treatment and why I am in this position. So when I left the hospital and after the antibiotics, then I was scheduled in April a extensive battery of tests again to make sure that everything was okay. I only got the results a month later, which was on the 16th of May, because there was tests that took a long time. When I went to do the test, it took 3.5 hours of waiting time of getting the tests done. But I did it. And when I got to my new doctor, I have a new doctor now, new HIV doctor, and he's also a cancer doctor at the General. He's great. He's accurate. He's to the point, and he is serious. And he obviously he can tell that I'm trying to do everything that I'm being told. So when he saw me on the 16th, he had horrible news. He said, because of the blood infection, and that the blood work and all the tests were done in mid-April, and we got the results just now. So he's giving me results from April. My CD4 count, and he said, I'm not even going to discuss the viral load. It's the CD4 that is in. He's like, basically, your body is going into like the other issue. If when you have HIV, if your CD4 count drops below a certain amount, you're in an AIDS phase. And what it means by that, I don't like the name. It creeps me out. It just means that any infection will go into your body and will kill you. And that's where I'm at. And at that moment, they put me on this treatment, this drug. Everything was taken care. I spoke to so many people. I was informed about the risks of this treatment, the side effects, the way that you need to have a card on your person in case I drop, and if for whatever reason I still breathing, then the paramedics will know this card. I have to have it on my fridge, and I have to give it to my work. And because of the situation I'm in, for other reasons, it is best that I work through this. And the doctor agreed to the point that I'm already immune to anything that's in my apartment and my dog. And I do go to the store, and I do go out. It's a risk, but I mean, I can't just not move and deteriorate in that sense. I won't let it. So this is how I got to this point. So right now, they're trying to do is save my immune system. So right now it's crashing. It's at very very low. No, there's it's not it's no point on saying the numbers and all that. This is not the point of this. And I started the treatment on the 16th of May, and it is because it was supposed to be for 4 weeks, and then they were supposed they would see you. I mean, it's going to go one or the other. It's either going to make me better, like to the point, like the sense that my immune system will go up a little bit, so that I'm strong enough to get the treatment and the surgery or whatever is needed to the cancer that's in me. That's now I have testicular cancer, and I have a tumor in my hand, and I have a tumor here, and the next, like, the cancer spreading, and it's usually when you go from anal to testicular, it's heading for the bones. There's no tests yet for they haven't done anything yet. There was no point. That's where it's heading. So this treatment it needs to work, and if it doesn't, it doesn't. However, I'll help with any questions, any testing, getting data for this situation that I'm in, that it never happens to anybody again. I mean, it was hard enough to talk about my situation, and that regardless of what people think, if you want to judge, at the end of the day, I didn't want to be in this position. I didn't do this on purpose. I didn't want to harm myself. I am not crazy. I just wanted somebody to listen and to believe me that I was highly medicated. It was already killing my body, and unfortunately, even if I regenerated my liver and I proved that something was wrong, and I did get help. I have new doctors. I have a new team of doctors, specialists for my eyes, for everything, and I have appointments all the time, and I'm looked after now. However, it shouldn't have gone to this point. I shouldn't be in this situation. I shouldn't, and all I can say is that I feel good about myself, that I did what I could with what I had, the situation I'm in. I did my best, and I think it's the only thing I can hope for. And if it's going to help somebody else by, the doctors and the specialists to test me and to me undergo different therapies and interviews, and how can somebody with a full-time jobs with benefit, with middle class background, end up with borderline AIDS in this day and age, and have to go under a radical treatment to save me. And in the meantime, I'm doing everything that I'm told. I am being very careful. I am being positive. The only thing I'm not going to do is I'm not going to prepare for anything negative. I will not stand for that. I'm staying positive. As far as I'm concerned, I'm going to survive. I'm going to beat whatever's happening. Then I'm going to beat the cancer. Um, it's going to either be an extremely long, difficult road, which I'm ready to face that, um, or like, we all know the outcome. If you are in that phase where your immune system is gone, you have AIDS, and um, I mean, you'll get bacteria from just going to the bathroom and just you wiping your bum. Like, I'm sorry, it sounds stupid, but uh, so I'm very tired today, and it's like it's been a rough day, but I wanted to do this video today, like for my day 13, to explain in my own words and with my expression. I mean, there's a lot of things I missed, and it's not really important. It's to give an idea of how the hell did I end up in this mess, and today, facing this crisis. It's important that people know that there's something, there's a story behind this. There's a reason behind this. It's not always black and white, and I'm tired of being judged, and people look at me, or people listen to me talking, or my frustration, or me getting all hyper. If you were in my situation, how would you have handled it? I had no one to turn to, and I knew that something wrong was being done to me medically, and it's my word against a professional, a licensed professional. Come on, like, it does, it doesn't make sense. This doesn't happen. Like, so, like, I'm not stupid. Like, it would have, it would have made it worse. It would have looked even worse if I would have pursued that avenue to prove what. It doesn't matter at the end of the day, whether it's a medical error, whether it's the outcome of my situation, of the way I lived my life, or the way I was, with my mental disorders. I don't care. It doesn't matter. Right now, it matters. I got here. This was the honest way I got here. Nobody at the hospital, all my doctors, all my specialists right now, they don't judge me. They don't say anything negative. The only thing they say is that they've never seen somebody with such fight in them, that such positiveness, and always smiling, always agreeing to anything they put me through, and my poking, and my arms are so sore from, like, the needles and everything that has been shoved in me. And that was important to me because I was that horrible patient, that rude, obnoxious, entitled prick that hated hospitals and hated doctors and blame. There was a reason behind it. I'm not saying it was right, it was valid. That's behind me now. It's in my past. I let it go, and I'm facing this like a totally different person or outcome. And I'll leave you with this thought. When I get, everybody's been nice to me. I mean, I can't say anything negative about the Ottawa General, about the cancer unit, about the Module G, about everybody at the Ottawa General, my home care nurses. Everybody has gone out of their way to either make me feel good, help me. I mean, everybody's been above and beyond. I just want to say that when I get how brave and how courageous and what a trooper I am, I say thank you and I smile. However, I'm not special. I'm not brave. I'm not courageous. When I look at those sick kids at CHEO that are battling cancer and leukemia and Lou Gehrig's disease and like all these others. Sorry, at this point I can't remember all the. And they're like 5 years old and 10 years old, and they have all their lives ahead of them. Their parents are absolutely destroyed and worry, and one parent has to stop working to help with the child. That is what I called brave and courageous and a fighter. Me, hey, I don't think I deserve any of that. Whatever reason that it's happening, hey, I still have a lot of experience that I've lived. I've met a lot of people. I have had a good life when you really think about it. There's a lot of people that are in worse shape. I made so many mistakes, and the last 2 years I have learned, like, if I was in school, there are so many things that are coming back that I'm learning about myself, about people, that I'm just amazed. Karma, that's a big one. So this is where I am. This is a situation, and that is what is going on, and this is why I call it my treatment right now, because that's what's happening. So the treatment is going on till the 18th of July, and today I felt good. I'm extremely tired. I'm extremely exhausted just doing anything, but I feel okay. Like, I feel I can do this, and I'm just going to continue thinking positive, and day by day, that's all I can say. And I'm going to continue telling my story. I'm going to continue, making you laugh, and having you go through this with me from a distance. And it's also going to keep me mentally strong to continue into fight in case there are bumps in the road. Like, there's already been bumps since the 16th of May. My rash is back right now, so I know that the blood infection somehow is back, and I know that's not a good sign. The same thing with the tumors and the cancer that's growing inside me as I try to build up my immune system. So it's a vicious circle. My immune system is trying to get stronger, yet everything inside of me is killing it with everything that I'm being attacked with and thrown at. But my mind is clear. My thinking is clear, and I know that's funny, and I know that some people are going to challenge that, and that makes me laugh and it makes me smile, because hey, maybe everything else is rotten and dying and collapsing inside of me, but my mind is still there. I'm still that same little obnoxious little crazy Dan, that just like that has this little kid inside that just wants to for people to laugh, and I still feel uncomfortable with a lot of stuff, and I'll just giggle and laugh at the most inappropriate time. I'm still there. That's still me. So thank you for this day 13. It was a long video, I understand. I just needed to get all this out so that there's an explanation to how come I'm here right now. So I'm signing off. And again, I want you to think about other people that are in worse shape, and um, do do some good. Make somebody feel good. Give a compliment. Bye.